Remember Deborah Bricks, the scarf lady, the face of science and the vaccine under Dr. Fauci? Well, listen to this. She admits it's not a vaccine and it was only meant for the people that were very old.
To young people in hospitals before it went into our elderly and nursing homes. And what we've done wrong in public health is we didn't explain that COVID vaccines were nothing like the childhood vaccines, and that the childhood vaccines, like many of the diseases, you get it once, you don't get it again, and this is getting the children to have that disease without getting the deadly consequences. That is not what the COVID vaccine was designed to do. It wasn't designed to prevent against infection. And if you look at the vaccine hesitancy rates, they've doubled since COVID. So we have to start addressing these things. We can't just ignore them.
And Deborah, let me ask you, Deborah, I mean, given that you were the face of COVID from the Trump presidency at the time, do you share this doctor who I was with, do you share the concerns about the longer term negative impact of some of the COVID vaccines?
The messenger RNA vaccine should have been rolled out for the people that were at risk for severe disease, because that's what the vaccine was developed for. But when we say that we're following the science and the data, we need to follow the science and the data. And the science and
Oh my God, I can't believe I just heard that. It wasn't designed for stopping the... Let's listen again, shall we?
And what we've done wrong in public health is we didn't explain that COVID vaccines were nothing like the childhood vaccines, and that the childhood vaccines, like many of the diseases, you get it once, you don't get it again, and this is getting the children to have that disease without getting the deadly consequences. That is not what the COVID vaccine was designed to do. It wasn't designed to prevent against infection. And if you look at the vaccine hesitancy rates, they've doubled since COVID. So we have to start addressing these things. We can't just ignore them.
And Deborah, let me ask you, Deborah, I mean, given that you were the face of COVID from the Trump presidency at the time, do you share this doctor who I was with, do you share the concerns about the longer term negative impact of some of the COVID vaccines?
The messenger RNA vaccine should have been rolled out for the people that were at risk for severe disease, because that's what the vaccine was developed for.
What?
But when we say that we're following the science and the data, we need to follow the science and the data. And the science and the data said people primarily over 65 or people with significant comorbidities were at risk for severe disease. Those are the individuals that should have been immunized first. And we should have put our science behind our immunization schedule and protected those most at risk. It went into young people in hospitals before it went into our elderly and nursing homes. That is not following the science and the data. So I am all for following the science and the data, but it shouldn't just be a statement. It should be a reality. And what?
Back it up, dumb.
The people who administered this non-vaccine, as Deborah now admits, don't want to look at the released data from a successful lawsuit of adverse events. Now, correlation does not mean causation, but listen to this.
That coronaviruses suggests human manipulation designed to increase the virus's infectivity in humans. Funding and connections. Documents reveal that funding for such research was facilitated through organizations like EcoHealth Alliance. The blanket immunity granted to key figures like those involved with the January 6th committee and Dr. Fauci might be seen as protection for those who orchestrated or knew about the manipulation of electoral processes during this period. Pharmaceutical companies and population control. Vaccine side effects. The push to hide vaccine side effect data for 75 years points to a knowledge of potential adverse effects, suggesting not just negligence but intent. If these vaccines were part of a broader scheme for population control, the side effects, including those potentially leading to population reduction, would be kept secret to maintain public trust in vaccine uptake. Previous misconduct. With over $2.3 billion in fines paid by pharmaceutical companies for various malpractices, and a total of $62 billion in fines across the industry, there's a pattern of prioritizing profit and control over health.
That's the last
This
decade.
history of misconduct aligns with the notion of using pharmaceuticals as tools for broader, sinister objectives. Here's a list based on the adverse events of special interest, AESI, mentioned in the Pfizer document that was released through FOIA, which does not establish causality but are conditions monitored post-vaccination.
That's what they wanted to hide for 75 years.
1p36 deletion syndrome 2-hydroxyglutaric aciduria 5-alpha reductase deficiency acoustic neuritis acquired C1 inhibitor deficiency acquired epidermolysis bullosa acute cutaneous lupus erythematosus acute disseminated encephalomyelitis acute flaccid myelitis adenovirus infection administration site thrombosis adrenal insufficiency agamaglobulinemia agitation neonatal allergic bronchopulmonary mycosis alopecia areata. Albers disease. Alternating hemiplegia of childhood Alzheimer's disease amaurosis fugax amyotrophic lateral sclerosis anaphylactic reaction anaphylactic shock angioedema. Ankylosing spondylitis anosmia. Antibody-mediated rejection antiphospholipid syndrome anti-sperm antibody-positive aortic dissection aplastic anemia arrhythmia arteritis arthritis ascites. Aseptic meningitis Asperger's disorder asthma. Ataxia. Atonic seizures atrial fibrillation atrioventricular block complete autoimmune hepatitis autoimmune neutropenia autoimmune thyroiditis autonomic nervous system imbalance axonal neuropathy B-cell lymphoma back pain bacterial arthritis balanitis Basedow's disease Behçet's syndrome Bell's palsy benign tumor of brain bilateral vestibular loss bile duct obstruction biliary cirrhosis primary bladder disorder blindness blood disorder bone marrow failure brain death brain neoplasm brain edema brain stem embolism brain stem hemorrhage brain stem infarction brain stem stroke brain stem thrombosis bronchial obstruction bronchitis bronchospasm Budd-Chiari syndrome bullous pemphigoid bundle branch block left bundle branch block right Burkitt's lymphoma C1 esterase inhibitor deficiency calciphylaxis cardiogenic shock cardiomyopathy carotid artery dissection cataplexy Cauda equina syndrome cavernous sinus thrombosis central nervous system vasculitis cerebellar ataxia cerebellar hemorrhage cerebellar infarction cerebral amyloid angiopathy cerebral hemorrhage cerebral infarction cerebral thrombosis cerebral venous sinus thrombosis cervical vertebral fracture Chagas disease cholangitis cholecystitis chorea Chronic fatigue syndrome chronic inflammatory demyelinating polyneuropathy chronic lymphocytic leukemia chronic myeloid leukemia chronic obstructive pulmonary disease cicatricial pemphigoid coliac disease cognitive disorder colitis coma Congenital anomaly congenital heart disease conjunctivitis convulsion corneal erosion coronary artery disease cranial nerve disorders cranial nerve palsies Creutzfeldt-Jakob disease Crohn's disease cryoglobulinemia Cushing's syndrome cystic fibrosis cytokine release syndrome cytomegalovirus infection decubitus ulcer deep vein thrombosis dehydration demyelination dermatitis dermatomyositis diabetes mellitus diabetic ketoacidosis diarrhea disseminated intravascular coagulation dizziness Drug-induced liver injury dry eye. Dry mouth duodenitis dysautonomia dyskinesia dyspnea dystonia eclampsia eczema. Ehlers-Danlos syndrome encephalitis encephalopathy endocarditis endometriosis enterocolitis eosinophilia eosinophilic fasciitis eosinophilic granulomatosis with polyangiitis epididymitis. Epilepsy. Epileptic psychosis Epstein-Barr virus infection erythema multiforme erythema nodosum esophagitis exophthalmos extrapyramidal disorder eye hemorrhage facial paralysis factor V Leiden mutation febrile neutropenia Feltes syndrome fibromyalgia fibrosing alveolitis flaccid paralysis fetal death fetal growth restriction folliculitis foreign body granuloma fracture fulminant hepatitis galactosemia gastritis Gastrointestinal hemorrhage gastroesophageal reflux disease generalized anxiety disorder giant cell arteritis Gilbert's syndrome glomerulonephritis Glucose 6-phosphate dehydrogenase deficiency graft versus host disease granulomatosis with polyangiitis Guillain-Barré syndrome hemolytic anemia hemophagocytic lymphohistiocytosis hemorrhagic stroke hemorrhoids Hashimoto's thyroiditis headache. Hearing loss heart arrest heart failure hepatic failure hepatitis. Hepatorenal syndrome, hereditary angioedema, herpes zoster, hidradenitis suppurativa, high-altitude cerebral edema, histiocytosis, hematophagic Hodgkin's disease, hydrocephalus, hypercalcemia, hypercoagulability, state hyperparathyroidism, hypersensitivity, vasculitis, hypertension. Hyperthyroidism, hypocalcemia, hypogammaglobulinemia, hypoglycemia, hypoparathyroidism, hypothyroidism. Idiopathic thrombocytopenic purpura IgA nephropathy. Immune thrombocytopenia immunodeficiency. Inappropriate antidiuretic hormone secretion infantile spasms. Infertility. Inflammatory bowel disease influenza.
Infertility.
Intestinal ischemia intracranial pressure increased intussusception
Wow.
iridocyclitis irritable bowel syndrome ischemic colitis Kawasaki's disease keratitis. Kidney transplant rejection Lambert-Eaton myasthenic syndrome laryngeal edema
Kidney
laryngospasm.
transplant rejection.
Lateral medullary syndrome Leber's hereditary optic neuropathy left ventricular dysfunction Legionella infection leiomyoma. Leukemia leukoencephalopathy Lewy body
Leukemia.
dementia lichen planus. Limb-girdle muscular dystrophy lipodystrophy acquired listeria
Muscular
infection liver
dystrophy.
cirrhosis liver injury lung abscess lung infiltration lupus-like syndrome Lyme disease lymphangitis.
Lupus, Lyme
Holy
disease.
shit.
Lymphocytic choriomeningitis lymphocytic interstitial pneumonia lymphoma.
Pneumonia.
Macular degeneration malignant neoplasm progression malignant otitis externa malignant pleural effusion malignant melanoma malignant mesothelioma meningitis. Meningitis aseptic meningitis bacterial meningitis fungal meningitis streptococcal meningitis viral meningococcal infection meningoencephalitis
Meningitis.
mesenteric artery thrombosis mesenteric venous thrombosis
Artery
metachromatic
thrombosis.
leukodystrophy microangiopathic hemolytic anemia microscopic polyangiitis migraine. Mitral valve incompetence mixed connective tissue disease multiple sclerosis multiple system atrophy
Multiple
mumps.
sclerosis.
Myasthenia gravis myelitis transverse myelodysplastic syndrome myocardial infarction myocarditis myopathy myositis narcolepsy necrotizing fasciitis
No
neonatal
wonder
jaundice
they don't
nephritis
want
nephrotic syndrome
Robert
neuralgia
Kennedy to look
neuritis.
at that. Holy crap.
Neuroleptic malignant syndrome neuromyelitis optica neuromuscular disorder neuropathy peripheral neutropenic sepsis Niemann-Pick disease non-Hodgkin's lymphoma obesity hypoventilation syndrome ocular hypertension esophageal achalasia oligohydramnios optic neuritis oral lichen planus osteoarthritis osteomyelitis osteonecrosis osteoporosis otitis media ovarian failure pancreatitis pancytopenia paralysis. Paraneoplastic pemphigus paraplegia. Parathyroid disorder Parkinson's disease paroxysmal nocturnal hemoglobinuria
Parkinson's.
parsonage Turner syndrome pemphigus. Pericarditis peripheral ischemia peritonitis
Pericarditis.
pernicious anemia persistent fetal circulation petechia. Pharyngitis phlebitis pituitary tumor pneumocystis Joravicki pneumonia. Polyarteritis nodosa polycystic ovary syndrome polymyalgia rheumatica polymyositis portal vein thrombosis postpartum hemorrhage postural orthostatic
These are the
tachycardia
adverse
syndrome
events from
preeclampsia.
Pfizer they
Holy
wanted to
crap.
hide for 75
Pregnancy
years.
loss premature labor premature menopause
The
primary
people who
biliary cirrhosis
administered
primary
this do not
sclerosing
want to hear
cholangitis
about
progressive
what they've
multifocal
done.
leukoencephalopathy
can blame them?
prolactinoma.
This is the government
Prostatitis
that
protein S
forced you to
deficiency
get this
pseudotumor
vaccine
cerebri psoriatic
or
arthropathy
lose your
pulmonary
job.
alveolar proteinosis pulmonary embolism pulmonary fibrosis pulmonary hypertension pure red cell aplasia purpura. Pyelonephritis pyoderma gangrenosum
Correlation
Raynaud's
does not mean
phenomenon reactive
causation, but
arthritis
this is
renal
the
artery
adverse events
stenosis
list
renal
they wanted
failure
to hide
renal
for
infarction
75
renal vein
years.
thrombosis
Renal
respiratory distress respiratory
Renal
failure
failure.
restless legs syndrome retinal artery occlusion retinal detachment retinal vein occlusion retroperitoneal fibrosis rhabdomyolysis rheumatoid arthritis right ventricular failure Rosé-Dorfman disease rotavirus infection rubella. Sarcoidosis schizophrenia sciatica scleritis scleroderma sclerosing cholangitis seizure. Sepsis septic shock serotonin syndrome serum sickness. Sickle cell anemia with crisis silicosis. Sjogren's syndrome, slipped capital femoral epiphysis, small fiber neuropathy, spinal cord infarction, spinal muscular atrophy, spontaneous abortion, stiff person syndrome, stillbirth, stroke.
Abortion.
Subarachnoid hemorrhage, subdural hematoma, sudden death.
Sudden death.
Superior vena cava syndrome, supraventricular tachycardia, suture granuloma, Sweets syndrome, syncope. Systemic lupus erythematosus, systemic sclerosis, Takayasu arteritis, temporal arteritis, tendon rupture, tension, headache, thrombocytopenia, thrombophlebitis, thrombosis. Thrombotic thrombocytopenic purpura, thyroiditis.
Holy crap.
Torsade de points, toxic epidermal necrolysis, transient ischemic attack, transverse myelitis, tricuspid valve incompetence, trigeminal neuralgia, TTP, HUS. Tubo-ovarian abscess, tuberculosis, tumor lysis syndrome, ulcerative colitis, uremia. Uremic encephalopathy, uric acid nephropathy, urinary retention, urticaria, uveitis. Vaccination failure, vagal nerve disorder, varicella.
Vaccination
Vasculitis.
failure. What the hell?
Vasculitis, necrotizing vena cava, thrombosis, venous thrombosis, ventricular fibrillation, ventricular tachycardia, vertigo.
Ventricular fibrillation.
Vesicular reflux, viral myocarditis,
Oh my
viral
God.
pericarditis,
There you go.
vitiligo.
Myocarditis, pericarditis.
Holy
Vocal
cow.
cord paralysis, both Koyanagi Harada disease, von Willebrand's disease, vulvovaginitis, Wegener's granulomatosis, Wernicke's encephalopathy, Wilson's disease, X-linked agamaglobulinemia, yellow fever. Please note that this list represents adverse events reported. Coup d'etat and totalitarian ambitions. Centralization of power. The global response to the virus, including mandatory measures, surveillance, and control.
Imagine having given this to patients in a nursing home and having to face them. Imagine what it would be like to have forced people to get this or lose their job. Imagine what that would feel like. Now, Dr. Fauci's protocols made it so I got a huge infection, was locked in quarantine twice, and lost my teeth, and then had a failed heart operation because of complications on the operating table due to being backed up. But at least I didn't get this genocidal shot.